Hi. Um, we'll give an update on my health. I've been doing better with the neck weights. Um, the tinnitus hasn't been as bad, thankfully. It's been like usually it's louder in the morning, just because laying down all night and it being a problem with my neck. But when I would go for a walk, normally then it would quiet down some because I'm upright and there's more increase, like my heart rate goes up to like 90, maybe a little higher, and normally it's at about 60 when I'm resting. And so it goes up higher, and then I get back from the walk and I feel better. And so I am now feeling like the tinnitus is at a level post walk, but before I even go for a walk. So that's an improvement. Like, it used to take a walk and then time and all that for it to get to a little lower so I could be more tolerable, and now it's not. It starts off at that level, and so that's a huge relief. It doesn't stay, like, I use the neck weights about a half hour every other day, so I don't want to overdo it, and I'm just going to be consistent with it, because if I'm having connective tissue issues, you have to be careful on how you approach exercise or anything that's going to be doing anything with the joints. And I have some weak stuff. Now, a lot of people will say, like, I have like this neck injury or this elbow injury and whatever, I can't work out. But I'm like, if your elbow is hurt and like you move your arm like that, does that hurt? Right? So then if that doesn't hurt you, then you can do that motion 30 times a day, whatever. Maybe with like a 2-pound weight or something like that. Like you do curls with like 2 pounds or something. And I know it sucks as someone that lifted like 35 pounds casually in curls. That was, it's frustrating to go to like 5 pounds. So for my neck, I want to do that and not overdo it, but I still want to do it. And it seems to be helping. I started off at 5 minutes with a neck weight. They're 15-pound neck weights, the ones you get at Caring Medical. But I got Dr. Middleton down in Fort Lauderdale, because Caring Medical said, hey, you don't seem like a good fit for us, even though I'm like literally the textbook example of them. I think their intake staff's like mentally ill or highly underpaid, probably both. And so I've been doing that, and I've been seeing, like, I still have the issue where, like, if I'm leaning forward or something, if my posture's not good, then I'll hear the high-pitched, like, ee sound for like 10 seconds, sometimes up to like 30 seconds, because the C1 is like squishing on something. And then I'll lean back and be like, God damn it, like, well, because you forget sometimes you're leaning forward, because maybe I'm aware, but I'm like trying to cook dinner or something. So I'll hear that and I'll correct my posture and it'll go away, because that's not the normal tinnitus. I have normal tinnitus that is like humming and hissing and ringing, but not that high pitched sound. That's only like if I lean forward and or like lay down on my neck funny, and the C1 squishes against the nerve or brain stem. I don't know what it's pushing against. It's pushing against something nerve related. That's my best guess anyway. So I still get that, and if I don't do the neck weights for like I'll do them, and then it seems like it'll start to go back to the way it was afterward. So I have to keep consistent with it. So I don't know if I'm gonna always have to do that, because I've heard of patients having to do that sometimes, just indefinitely. Because I think what you're supposed to do is you're supposed to get the neck weights, you get the neck curve where you want it. Then you do posterior injections like prolotherapy, PRP, stem cells, whatever. And that strengthens the ligaments. So now they're strong. They get repaired in the correct position, and now it'll stay. So you don't have to keep doing the weights every other day. Maybe from time to time you might do them because over the course of your life, maybe you still have that. You get a little hunched over, you're looking at your cell phone, you're cooking dinner, you're writing, whatever you're doing. Maybe you would have to do that. But that's where I'm at now. I still have the issues with my shoulder. My left shoulder is frozen. Like, that's about as high as I can raise it. It just doesn't go. It's not that hurts. It just doesn't go. Like hey, how's it going? Like I forget what it's called. Capillary something. The joint is just locked down. And I've seen doctors say like, oh, we don't know what causes it. And I'm like, what do you mean you don't know? Like, if you damage the, what do you call it? I can't even think now. And I'm acting like I know. What do you call it? The rotator cuff. Yeah. So, I haven't eaten anything or taken any vitamins, so my brain's a little foggy. But the rotator cuff, if that gets injured, you're more likely to develop frozen shoulder. And I'm like, well, hey, there's a correlation. It seems like a body's natural response to some injury or weakness, like say you just never worked out your shoulder or never used it or something like that, would also become weak, is to say, okay, we've sent some damage and we're going to lock it down. And what doctors do is they take an MRI and they're like, oh, we don't see any problems, therefore it's happening for no reason. And I don't think doctors understand that MRIs can't see shit when it comes to like tears in connective tissue, unless it's like catastrophic, like if you have an ACL and it's torn completely in half, like it's just separated, the MRI is going to see that. But say there's a bunch of little tears, how would it see it? Because like even with the naked eye it would be hard to see, and the MRI is really shit resolution. So, and you just wouldn't, like if you take a pack of like, they got like the bison meat, it's just like one big slab of meat. It's not like ground beef where it's like sort of has a texture to it. It's just like a brick, right? I think you can get them for beef too. But anyway, they have those in like a lot of the like grass-fed stuff. Hey, how's it going? A lot of the grass-fed stuff and wild game meat comes like that. So anyway, take a brick of that, take a knife, stick it in, pull the knife out, squeeze the meat back together. Can't see it anymore. Like there's no cut, there's nothing, and you're looking at it and there's nothing. You can't, but the thing's has been stabbed with a knife, and you can't even see it. So it's like injuries like that, where you're gonna have like 1,000 little tears and cuts through the tissue. Yeah, you can't see any of it. And this has been proven. Like people have taken like a cadaver that had a neck trauma, and you have taken MRI of it, and then you slice it open and you cut the person's neck up into pieces you can put under like there's like glass you can put on either side of it to like have a sample of it. You can hold it up to the light, magnifying glass, whatever, and you can just hold it up and look at it and just like, oh my god, this is horribly damaged. But the MRI, you couldn't tell it just looked fine. So I think a lot of doctors are like, they don't know this. And I mean, this isn't just me coming on with this. This is like a doctor who, Dr. Centeno up in Colorado, who looks at MRIs all the time, specifically for connective tissue problems. He's the one that told me about this. And he showed me a study that was done and all this stuff. And it's like, so doctors are thinking, oh, these things just happen for no reason. It's like, but there's no imaging out there that's any good for non-catastrophic like connective tissue injuries. I mean, to actually look at the ligament or the tendon, like a digital motion X-ray, you can move around your head, and you can see the vertebrae. Okay, they're not functioning correctly, so obviously there's ligament damage. But you can't see the actual ligaments in the X-rays because it's an X-ray. It's not great for that. Um, so I'm I know that I felt something tear. Like I played sports for ever. I'm 38 and I started before I could walk. I was swimming and I never stopped playing sports. So like I incurred soft tissue injuries regularly, and I know what they feel like. And there's a muscle tear and there's a soft tissue tear, and they don't feel the same. Sometimes they can feel similar and they can be in a similar area, but I'm pretty fluent in tears now. So I hurt my shoulder, I tore it. Then I got a frozen shoulder, and doctors are like, we don't know what causes it. And it's like, yeah, we do. Maybe not every time, right? Because bodies are weird and genetics are weird, and who knows what chemicals are going into our body. And there's that whole cocktail of stuff where weird stuff can happen for weird reasons. But sometimes it's because of damage, for sure. It's probably most of the time. Because why else would a body lock down a joint unless it, like, if it's working fine, why would it do it? So, and I'm not saying our bodies are perfect; they're stupid sometimes. So I'm still dealing with that, and then my right shoulder, like I was doing the like arm extensions, like just side and then front with like 15 pounds, and just like way too close to my face. So and then I was like, that doesn't feel right. It feels like a soft tissue problem that I got going on. Like while I'm doing it, I'm like, oh god, like I got to take it easy. Because so I started doing these where you like so you have like something in the door, like those elastic bands that you can get like on Amazon or wherever, and I put one in around the doorknob, and then I'm like pulling it out this way and then come back and pulling it out, and then I'll turn around the other way and I'll pull it this way and then go back out and pull it this way, and that feels fine. Like I don't feel any kind of tweakiness or awkward pain in my shoulder. So I'm like, well, I gotta strengthen my shoulder somehow. So that's the only exercise I can do that doesn't seem to make it worse. And that's a good shoulder exercise, like any physical therapist will tell you that. So I'm doing that. And I'm still working out my hips with the where you just like spreading your legs apart, squeezing them together. There's resistance both ways. At the hip abductor and adductor at the gym, doing the sled pulls where you're just walking backwards, and you got a belt around your waist, and you're pulling whatever, a sled, a stack of weights on a piece of metal, whatever. They've got different options at my gym, so I do that, and I'm just trying not to. I'm trying to do lower weight, higher reps, and increase the weight much more slowly than I would normally, because my muscle's fine. My muscle's like, I'm ready to go. I'm ready to go up to 100 pounds, 150 pounds, and I'm like, but my joints are like lagging behind. And I think part of it's because I atrophied a lot because my neck injury. I didn't do anything physical because it would aggravate my neck. Like, there's so much you do with your neck. Even riding a stationary bike where your back's supported, you're still having to keep your head up. It's just, so I wasn't doing that much, and all my joints atrophy. Now I don't know what's causing it. I don't know if it's celiac. I don't know, like, because you can have issues. There are people that eat gluten. Like I eat gluten, I get stomach problems. My stomach hurts. I get diarrhea. My joints hurt. It's not terrible, so I never really thought much of it. I was just like, oh, sometimes you get diarrhea. Maybe I was eating with my hands or whatever. Or maybe, maybe my joints hurt because I'm always physically active, right? So I'm just thinking, I'm 30 in my 30s and my joints hurt, and I just played soccer yesterday. It's like, yeah, maybe but when I haven't been active, I'll notice like, okay, I didn't eat bread for a week and my joints were fine. Second, I ate bread or like a muffin or whatever, anything with gluten, then it was like, okay, now my stomach is bothering me more. My joint pain is worse throughout my body, and I don't know how that works. I don't know if it's the nutrition isn't getting there. I don't know if the gluten is being spread around my body and being used in my joints, and then I'm having an autoimmune response, and that's attacking those areas and tearing up my connective tissue to get that shit out. That's just a total guess. I have no research at all to believe that. I don't know. And because I'm just thinking about stuff because the doctors don't know. I usually don't waste my time with trying to figure it out on my own if I can just look at existing information. I'm not trying to reinvent the wheel, but so like, but I don't know, like you can have damage to your stomach where you it's like not going to absorb nutrients properly, and so that could be happening if I'm damaging my stomach and then the nutrition's not getting to my joints, like, so. But I don't know, I mean, because I take glucosamine and my joints feel better, so that's getting to my joints. So I don't know what's going on with my connective tissue. I just something. I know it's worse when I eat wheat, a lot worse. I don't know how the mechanism of that, but I know that is a fact. So next week I'm supposed to get a gastroenterologist to go down my throat with a camera and check things out. Imagine they're not going to find much because doctors never find anything. Like, I can't remember the last time a doctor found anything that I didn't already know about. Like, it's just, I don't know. I mean, a lot of times doctors don't put, like, a radiologist takes 3 minutes to try and figure out some imaging. Doctor spends 5 minutes with you. Like if I was in charge of trying to fix someone and they came to me for like their physical, I'd be like, okay, I'm in charge for this person's health. I need to like sit their yearly physical or like you get it every 2 years or whatever. I would say, okay, I'm gonna check this person's blood for nutrition, every nutritional marker I can think of. Might as well check hormones. You never know. I check flexibility, general flexibility of all the joints in the body, see if like there's an issue there. I would check resting heart rate. I think they do check that in doctor's office. And then I'd screen for common types of cancer, because why not? I mean, I don't think it's reasonable to check for every single kind of thing that could ever happen to anyone ever, but run the comprehensive test to check for everything, because like this is someone's health. Like if it was a car, I would check like all the fluids. I like if the car hadn't had the transmission looked at in 10 years, I might rebuild the transmission. All the spark plugs in the engine would be replaced. Like I would check the gas tank, I would check the muffler, I would check everything, the tires, the alignment, like all this stuff. And then when we go to the doctor's office, the doctor spends 5 minutes with us and like doesn't do anything, and it's like, why are we taking better care of our cars than our actual human bodies? It's ridiculous. It's like, but the insurance is like, no, it's not necessary, you don't need to do that. And it's like, we could prevent stuff and the insurance agencies would win because they'd have to pay out for less. And I don't know what led to us being here, but that we're here, and it sucks because it's like, I mean, just to get my hormones checked. I mean, I went to several doctors and like, can I get my testosterone checked? And they're like, no, why? I'm like, I got weird problems all over my body. I don't have any hair on my chest, so not a lot of men have that. I know I'm just completely hairless. So I'm like, I don't know if I had less testosterone growing up. Although my brother didn't have any of these problems, and he didn't really have much hair either. So I don't know, but I'm just like, let me get my testosterone checked, and they won't do it. And they won't do it. And won't do it. And I'm like, they'll literally shove a camera down my throat to look in my intestines, but it won't check the hormones of a 38-year-old man. And it's like, why? Like, why is that a big deal? Just do it. Like I came in, asked for it, do it. Like if I just did it last week, yeah, don't do it again. But I've never done it in my life. I've never checked for like vitamin D is a hormone. Like I have had that checked for, but not testosterone. It's like how are you not going to check the testosterone in a man ever in his life? Like like the kind of problems you develop if that's not good are horrible. And I think we've had a lot of problems with that in people. I don't know if it's because of plastic or what, but a lot of people nowadays. I think actually I know more people getting treated for it, but I think actually more people have issues with testosterone than they used to before as well. So it's not just that more people are getting checked. I'm pretty sure. I mean, we're all pretty sedentary and pretty fucking out of shape. And I mean, I go to the beach and I'll see like 2 people out of 50 that are like in reasonable shape, and that's the beach. Like, it's ridiculous. It's crazy. Um, so yeah, I still have bad days, like frequent enough to where I'm like, I don't know if I can work, but I'm gonna try because I've tried to work, and then people are like, "What are you doing?" And I'm like, I can't focus. Like I can't think. I can't. And people don't want to hire someone. Like if I tell someone I have anything wrong with me, they don't hire me. And if I don't tell them, they are like, "What the hell's going on with you?" They're like, "You're not performing at a reasonable level." And I'm like, "So," and then I can't keep the job. And yeah, so it's hard because a lot of the stuff that'll help me, like regenerative medicine, like stem cells, for like I could go get stem cells in my shoulder to treat the rotator cuff, and I could do that on the other shoulder, and I could do posterior injections in my neck, and I've been having back problems, hip problems, and you're looking at $30,000 for all that. If you want to get Regenex, if you want to get the good stuff, and where they really know what they're doing, and they have the highest quality stuff, then you know maybe I can get prolotherapy. I'm checking with the doctor, see if I can get prolotherapy cheaper next week. And I also had a chiropractor squeeze my chest, and like he reached under my arms and tried to crack my back by squeezing, like doing a reverse bear hug, and like popped my rib out, and I hurt like a motherfucker. I went to the ER Saturday because it hurt so bad. I was just like, I can't. Like this is an intense level of pain. I'm not going to be able to handle it this every day. So I go there, and of course they don't give me any painkillers because they're like, the whole opiate epidemic. And I'm like, they acted like I was a trash human being. I'm like, I'm not. Like, you doctors are trash people because you're the ones who the pharmaceutical companies were like, hey, so like we did this test and it says that our stuff, our opiates, which never mind the thousands and thousands of years of like opiate addiction that have ravaged the world and we have historical records of, our opiates don't have any negative effects. So, give everyone these perks and, we're all going to have a good time. And doctors believed pharmaceutical companies when they said that. And then even when, like, it didn't, like, doctors aren't complete fucking morons. They noticed when they were giving people these opiates, there were problems shortly afterwards. People started reporting having negative effects. So they just kept fucking doing it. At that point, that's on the doctors. So pharmaceutical companies fucked up, doctors like you all fucked up, nurses, whatever, medical professionals. Um, so you guys fucked up. I didn't fuck up. Okay, so sometimes I'm gonna need some opiates or something, like, and I don't think it's unreasonable. Like, don't give me a 3 month supply of like 30 milligram pills. Just give me 5 milligram pills or whatever. Just low dose, just something to take the edge off, and that's it. I don't think that's unreasonable, and I don't think I should be treated like a piece of shit because you guys were pieces of shit. Okay, I'm not a junkie. And even if I was, that'd be your fucking fault. Probably. I mean, there are people that obviously they get addicted on their own. But I'm just like, I didn't do anything. And they're acting like, what are you coming in here saying like you just want these painkillers? Like, I'm like, because I'm in pain. Fucking morons. Like, Jesus Christ. So yeah, that's everything I think what's going on with me. So So I'm gonna keep at it and keep everyone updated with stuff. I know there's a lot of stuff that kind of meandered around, but it's also like, if I don't say this stuff, then I'm gonna forget it, and there'll be no record of it. And anyone else is going through this, like maybe one part of this applies to you, but if I don't say it all, like, it's not going to be out there for people to find, and these are complicated health problems. So I'm not just talking to hear myself talk. Thanks.